Why is it that your gums bleed when you brush your teeth for the first time in a couple days or more? The answer. Here are some pertinent bullet points for everyone. Plaque. Soft microscopic bacteria that has colonized, come together, to the point where it can be seen, felt. Bacteria causes infection. That's why gums bleed. Bleeding is not a result of you mutilating yourself brushing or flossing. It is bacterial infection. Plaque takes 4 to 12 hours to form. Calculus. Nope, not math. Also known as tartar. If plaque is left undisturbed for approximately 24 to 72 hours, the minerals in your saliva invade it and harden it. This hardened buildup is porous and holds more bacteria. It must be professionally removed. It is not safe to use dental tools at home to remove it, as you can cause damage to your root surfaces. Having calculus buildup means that no matter how much you clean, bacteria will still be sitting in those areas until you get it professionally removed. If you're getting calculus buildup, it means that you're not reaching that area with your toothbrush floss. Gingivitis, reversible gum infection from plaque bacteria. It is reversible by cleaning up the bacterial infection with good home care. Reversible infection does not cause bone loss around the tooth. Periodontal disease. Irreversible gum disease. Bone loss is present. Once you have periodontal disease, it can only be managed, not cured. The bone around your teeth is what holds your teeth in your face. The more you lose, the more foundation the tooth loses. The harder to keep things clean, and the more likely you get tooth loss in the future. Gingivitis is the first warning sign that you're on your way to periodontal disease. Calculus speeds you towards periodontal disease. How will you know if you have cleaned up the bacterial infection? You will go from having lots of bleeding and lots of sensitivity to less bleeding and less sensitivity, and then no bleeding and no sensitivity. Flossing is only effective if done correctly. If you cannot or are unwilling to floss correctly, there are great YouTube videos. Then a water pick, used at highest pressure that you can stand, is an alternative, not a replacement. Tooth loss in old age is not something that naturally happens. It is a result of gum disease that has had years to progress. It is not natural or normal. Disclaimer: I have simplified a lot of these things to make them easier to understand. Follow this channel for more Santa Explains. And if you have any questions I should answer, just write them down in the comments.